Dr. Monique, welcome to Love No So Dummies podcast.
Thank you. Thanks for having me.
I'm so happy to have you today. I have been anticipating this conversation with you because I feel that my audience is going to absolutely enjoy it.
I hope so.
Yes, they are. So I see that you were born in Toronto, Canada, right?
Yes.
Grew up in Coral Springs and spent the summers in Canada and Jamaica.
Yes. Yeah.
You were busy.
I was all over, yeah.
Yeah.
My parents are Jamaican. They
Okay.
moved to Canada for school. I was born there, and then they decided to move to Florida.
Wow.
So they were always busy working. So most summers I was usually gone because they were working. So I would go back and stay with family, friends.
Wow.
And I really just grew up down here during the school year, and then most summers I was away.
So do you still do that today?
No, I've moved back and forth quite a bit. Like I went away for college to DC, came
Okay.
back, moved to like Arizona, LA for dental school, came back. Then I was in New Zealand for a couple years and Toronto again, and recently came back about 3 years ago.
Oh wow.
So I keep going back and forth, but now I'm back.
You're back.
Now I'm back for good.
I love DC. You know, my daughter just moved there. I'm going to say now a year ago, because she got a job there. You know,
Oh,
she finished
lovely.
college at FAM and then she got her job there. So DC is
It's an
my
amazing
spot.
city.
Oh my
Yeah,
God, I
I love it.
love DC. So now you currently reside in Fort Lauderdale.
Yes.
Okay, and how do you like living here?
I
And
love it.
you do?
Well, Florida's home. I grew up
Yes.
here. I'm definitely a Broward girl. I love Fort Lauderdale. Grew up in Coral Springs, which is like northwest Fort Lauderdale.
Yes.
Now I'm downtown Fort Lauderdale. My office is in Plantation, which is like a little bit further west.
Yes, yes.
So I love it. It's like right by the ocean. It's kind of like a big town, little city feel. It's not as busy as Miami yet. It's getting there.
Yeah.
But yeah.
I like
Yeah, it's really nice.
Fort Lauderdale is
It's
super
paradise.
nice. Yes, it is.
Yeah.
That's exactly how I see Miami, period. Literally
Yeah.
like a little paradise. Now I see that you're divorced.
I am.
And how long have you been divorced?
I've been divorced about 5 years now,
Oh, wow.
2020.
Okay, so are you currently dating?
I think dating, yes. I've recently just been out with, just ended things with someone that I was with for a bit.
Oh.
So just taking it easy right now.
Yeah.
So, yeah.
And that's what you should do. Just
Yeah.
relax, and if it works, it works. If it don't,
Exactly.
cut it off. No
Exactly.
children.
No children. No.
No children, okay.
Not yet.
So I see that your hobbies are traveling,
Yes.
live music, free driving. When I
Free
saw
diving.
free diving,
Yeah.
free diving.
Yeah.
Oh my goodness, because when I saw that, I said, wow, she likes the same things I like.
Oh, really?
Traveling, a band, go somewhere and have a live band.
Yeah.
That's my jam.
Yeah,
Tell
I
me
love
about it.
music.
So when you say traveling, do you travel often?
I travel quite a bit, because especially now, like my work schedule is very crazy. It's very hectic.
Yeah.
So, and most of my close friends don't live here. They live in
Oh.
different states, different countries.
Okay.
So at least a few times a year, I try to travel, like a lot of long weekend trips, and then in the summertime, I'll try to take a couple bigger trips.
Yeah.
So yeah, I'm always going. I'd like to go somewhere. Like I think 2 weeks ago, I was in Nevis. My best friend from high school lives there. It's a small
Oh.
island in the Caribbean.
Okay.
In August, I'm going to go to Spain with my best friend from college. We're taking my godson to a soccer camp, so that should be
wow.
awesome.
That's so cool.
yeah.
Yeah, I
It's a
love
good
traveling.
way to meet up with friends
Yes.
and see new places.
Yes, and especially after just, working.
You need to
and,
have something to look forward to. So I like to
Yes.
have a trip to look forward to.
and I have so many trips coming up in the next few weeks. I'm going to New Jersey next week, and then after that, we're going to New Orleans, and then after that, we're going to Tennessee for a reunion. Listen, I got a lot going on,
Oh,
but
that's
I'm
awesome.
looking forward to it. I'm telling you.
Exactly.
Live music. So when you say live music, are you talking about like bands and...
Yeah.
Yeah.
Well, because I grew, like my dad loves music. I grew up in music, so I just love music, all types of music. I pretty much listen to anything. So as long as it's like a live performance, I'm most likely gonna like it.
Yes,
If there's
yes.
like a live band, a live singer, I'm most likely gonna like it. So yeah, pretty much anything. And especially in Fort Lauderdale, they always have a lot of festivals on the weekends.
Yes, yes.
But like you might go to a little spot, or they might have something by the beach, or like by Las Olas or
Yes.
something. So yeah, I
And-
just think it's like a nice atmosphere. It's more relaxing, and it's just a good vibe.
And I was about to say, Los Olas is my spot. When I just want to go and just really have a nice vibe, with all the restaurants, and then they have the bands out there. Oh, listen, it is definitely my spot. Now, free diving. Oh my God. You have to
I
be
know
bold.
a lot of people are like, "What is that?"
No, you have to be very bold. You're talking about
Well,
the water and all of that.
I know. Well, actually, because I guess growing up, since my family is from the Caribbean, like we kind of would do that, and I didn't know there was a name for it.
Okay,
Until I
okay.
moved back to Florida, I became friends with one of my neighbors that's an ex-Navy SEAL, and he got a group of people together.
Yes.
So he took me to the store where we buy like the big fins and the mask and everything, and it's basically just like scuba diving without the oxygen.
Really?
Yeah. So it's best. So you have really long fins, so you can do like longer strides and swim
Right.
more. And he taught all of us. It's a small group, and he taught us how to do like breathing exercises to hold our breath longer, so we can be under longer. So I find it really cathartic because I'm a water baby. I love the water.
Right,
It kind of
right.
gives me peace. It makes me happy. So it's a great distressor. Like you just go and just basically just swim, hang out.
I think
you see ocean life.
Listen,
Yeah.
I am definitely that girl. Ocean, water vibes. That's
Yeah,
me.
especially in Florida.
Yes,
There's
yes.
a lot to see. There's like a whole little ecosystem going on, a whole
Yes.
little city under there.
And it's so much, it's just so peaceful when you're just around water.
Yeah.
But I just haven't gotten to the free diving.
Start with the snorkeling.
Yes,
Start
okay.
with the snorkeling, and then just bop your head under a couple times, and then you're basically free diving.
Wow,
Yeah.
really? Okay. Now, Dr. Monique,
Yes.
tell us a little bit about who you are and what you are most passionate about.
Oh wow, that's a loaded question.
I know, right? I know.
Oh, that can encompass so many things. Who am I? Well, well, as a lot of my close family and friends would say, I'm like a cat on their 7th or 8th life.
Wow.
I think life is definitely an adventure. I've had different storylines in my life thus far. I had a whole nother career. I was an interior designer, went back to school at 30.
Really?
Became a dentist, yeah. So this is my second career, so I started in it late. I didn't start it like in my 20s like most
Right.
people do. And I'm one of those that's like, I think, life is meant to be explored. It's
I
meant to
agree.
be seen. It's,
Yes.
like it's a learning. You're learning yourself. You're learning what you want to do, what you want to be. And I think it's really good to be a continuous student, not a never-ending student.
Oh, right.
But a continuous student.
Absolutely.
So I like
Always
to-
open to learn.
Exactly.
Yes.
So I like to learn new things, do new things. And I really believe in humanity and the goodness of people and the betterment of people, regardless of where you come from, when you come from, however you are. Like, humility and humanity is a very big thing
Yes.
in my core value system. So that's probably the basis of who I am, I would say.
So how did you get into interior design? I'm curious.
Oh, okay. So that was, well, basically when I went to college, I went to George Washington in DC. And like I said, I had a background in music. I used to sing a lot.
Okay.
I did
Oh.
classical and like classical opera and stuff. I told you I've had I've had like
Wow.
9 lives.
So
I did like
cool.
classical and opera and stuff, and then I did jazz music in college. And I wanted to do music. But my family, they're Jamaican, and they're like, that's not a stable profession.
Yes, yes.
So I picked the most artistic profession. I literally looked at the catalog and I picked the most artistic profession that I thought I would like. And I was like, all right, let me just do this. So I just randomly picked it, basically. And I'm very artsy. I'm very abstract in thinking, which works with design and with dentistry. So
Yes.
I turned out to be good at it. So yeah, basically it was just, I just picked it.
Interesting.
Yeah.
Interesting. And how did you, okay, so from interior design, you went into dentistry. Now, what made you go into dentistry? What?
Well, my father is actually a dentist.
Oh, okay,
Yeah.
okay.
My dad's he's a specialist, a periodontist, which specializes in gums and things
Yes.
like that. But he does general dentistry as well. So I grew up in his office and his practice. I grew up in the profession, so I knew of it.
Okay.
And when I was doing interior design, I did very well because at this time it was like early 2000s, like the real estate boom here was very busy. But the business side of it was a bit much for my personality. It was
Got it.
very overwhelming for me.
Wow,
So I loved the
okay.
artistic side, but the business side of it was very overwhelming. So I knew long-term wise, this wasn't something I could sustain long-term as a profession.
Okay.
And I knew at some point I wanted to like have the freedom or flexibility to have a family, and I didn't have that with that.
Okay.
So I started to look at, I literally interviewed all my friends and family that were like in some sort of medical profession, and got their opinions. And all of the females that I interviewed that were dentists actually had positive things to say, and they liked it.
Oh, okay.
My friends that were veterinarians, they're like, no, you're going to be too emotional. Don't do it. My friends that were pharmacists, they didn't like it. My friends that were doctors or internal medicine, they're like, yeah, it's too intense. Don't do it. You're not going to like it. But my friends that were dentists and my cousins that were dentists are like, they really had positive things to say. So I was like, all right.
Wow.
So I was like, okay, let me check out dentistry.
Wow.
So yeah, that's how I kind of got into it. And actually, the schooling part, especially at 30, it was hard.
That's what I was about to ask you.
It was hard. If I knew it was going to be that hard, I would not have done it. It was intense because especially, everyone's like 10 years younger.
Yeah.
I'm used to like a pad with paper, pens, and highlighters.
Yes.
Not everything on the computer.
No more.
So the whole learning curve, just that alone was very
Trying
different.
to adjust to today.
And going from like your own business with a disposable income to now you're a student and you have to listen to other people. There was a lot going on.
Yeah.
But now actually in the profession of working, I love it. I love the work. I love my patients.
Amazing.
I have a lot of patients, and I actually
so
go to work every day,
cool.
and I love the work. It's a lot. It's busy. It's crazy.
Yeah.
But I really, really enjoy what I do.
That's all that matters. At least you enjoy it,
Yeah, I
because
really
you have
enjoy it.
so many people in professions and they literally hate it.
Exactly. And
So-
because you spend most of your life actually away from home working. So
Yes.
if you're going to be working, you should enjoy what you're
Enjoy
doing.
what you're doing. I totally agree
And
with
not be
you.
stressed out about it.
Okay. I agree. So who has been one of your biggest influencers as well as mentors?
One of my biggest influencers or mentors. Let's see. Actually, I would have to say, I know it sounds kind of silly, but my father definitely is one. 100% for sure. He came from very, very humble beginnings.
Yeah.
And he's like, he's done like a complete 180 and he's done a lot. And as he started to come up in his career, he helped a lot of people come up in their careers.
Yeah, okay.
So he's been a real big mentor without knowing it, just because he has a good heart to a lot of people. His work ethic, I greatly admire. I work hard. I don't have his work ethic though, because he's a whole nother level.
Right.
But his work ethic and passion for what he does and just trying to help people and the betterment of people.
Yes.
It's really astounding. Like it's really amazing to see in person. And then I would say a couple of my close friends that are, because yes, I haven't had a family and stuff yet. That would be great to have, but a couple of my close friends that their moms. One of them, she works with her husband in his business. She left her career to work in his business, and she has 2 kids. And just to see like the multifaceted things that she has to do on a daily basis, like the quarter bit that she tells me stresses me out. So, so just to see all that she's able to do and still be a sound, gorgeous woman is, yes, I would say those 2 are my real, I definitely go up to both of them.
Amazing. Love that. Now let me ask you this, because I think that this is very, very important. How important is a healthy smile when first impression, especially in dating?
Oh, it's huge.
I agree.
I would think it's huge. It's not just superficial, but like just to get to the bare bones of it, hygiene in general is very important.
Big.
And now working in the dental medical field, I realize that it's, common sense is not that common.
No.
And I've had grown patients that some of them are just lazy. Some of them really just didn't know any better.
Right.
And I've had grown adults where I've had to teach them proper hygiene and the frequency of proper hygiene. And they, for like 40, 50, some even 60, 70 years, they didn't know and they weren't doing it well. So I think it's very important, one, of course, for looks, things like that, but also the person's confidence.
Yes.
The person themselves, if they have a nice smile, their breath smells well, things like that, they are going to be more confident. They are going to smile more. They are going to be more expressive.
Yeah.
And it makes it easier for the other person to get to know them.
Yes, yes.
And then also, because there's a lot of oral issues that if you're not taking care of your oral hygiene, it can lead to a lot of health problems.
Yes.
That a lot of people don't realize, from heart problems, fertility problems, endocarditis, different things. So it's very, very important.
Yeah, and it's something you just said earlier, when you just said that some people really just do not know. They haven't been taught.
Yeah.
And I had to really, really understand that just being an influencer, a social media influencer, because I know how I was raised. So, you go into things, you go into things assuming everybody know this. You understand? You go assuming that everybody parents taught them this. There's no way you don't know this. You
Exactly. Their parents or their grandparents or
somebody taught them this. But I had to realize really, really quick, fast, in a hurry, everybody was not
Yeah.
raised the way you were raised. Everybody was not taught the things that you were taught. You understand? You have grown people, just like you said,
Yeah.
that really do not know. You understand
Yeah.
what I'm trying to say? And at first it's shocking because you be like, no,
You're like, seriously, you really don't know?
You got to be kidding, right? But then I had to realize, no, they really don't know. You understand? So yeah, I found that to be very interesting. Not only that, it's super, super true. Very, very true. Now let me ask you, what are some common dental mistakes people make that could be affecting their confidence without even realizing it?
Dental mistakes. Okay, so something that very simple as far as like everyday hygiene. Like yes, you need to brush your teeth twice a day.
Period.
Period. But the reason why we do is you have to brush your teeth first thing in the morning when you wake up. So you're brushing the biofilm, the fuzziness off.
Yes.
Because if you don't, if you like eat breakfast, things like that, eat breakfast or drink orange juice or coffee, it's almost like that biofilm becomes like duct tape on your teeth. So it'll stick to it. So if you brush your teeth after, you're actually brushing away a lot less of the biofilm.
Yes.
So it's going to build and it's going to turn into plaque and eventually calculus a lot faster. Same reason at night. You have to brush your teeth at night. Last thing before you go to sleep, so you're brushing that biofilm off before you go to sleep. Because when we're asleep, our body's like rejuvenating, cells are turning over, and it's having a field day.
Yes.
A common thing that I've noticed with a lot of patients is you have to brush your tongue.
Mm.
Okay, you have they have tongue scrapers, they have mouthwash.
Yes.
The bare minimum, you have to brush your teeth, you have to brush your tongue, and you have to use regular floss. All of the other stuff is just additional.
Absolutely.
Stuff.
Absolutely.
So a lot of times, people are like, oh, I brush my teeth twice a day. I brush it 4 or 5 times a day, and they have horrible breath. They have halitosis because they don't brush and clean their tongue.
Their tongue, absolutely.
So it's something very basic, but yes, every day when you brush your teeth, you brush your tongue. Another thing is a lot of times someone might have, like if you have a little chip on your tooth, fine, but somebody might have a little cavity.
Yes.
And a lot of times like life is hard, like especially people, we have bills, we have different things going on.
Yes.
So if you have a health problem, you're more apt to go to the doctor. But if you have like a little cavity, you're like, whatever, it's not bad. I'm not having pain or anything like that, so I'm not going to deal with it until it becomes a problem. And then they come to me. But a lot of times when you do that little cavity that you might notice that look like a little grain of black pepper, if you leave it after a few months or let's say like a year and a half, it can get to the point where it grows enormously.
Yes.
And it can lead to a root
canal,
or you possibly losing your tooth. And then the other thing is like, if it gets to the point where you get an infection like that, you get like an abscess.
Yeah.
The abscess, our whole body's connected. It's all one big unit that's connected.
That's right.
So you have the abscess, it can get into your bloodstream, and that's how you can get other health problems, and it can lead to heart problems and different things like that. Also, regardless of your age, if God forbid it's to the point that you have to remove the tooth, once you remove it, you have to replace it, not just out of vanity or anything like that, but function, because our teeth really fit together like puzzle pieces. So when you have one tooth missing, the other teeth shift.
Yes,
and they're going to always shift to where there's an open space. They will move to the right, to the left, up, down, wherever the open space is.
Wow.
And then that's going to throw off your bite. So simply like losing one molar tooth, which is, it's actually really common.
Yeah.
Losing one molar tooth, all of your back teeth will shift. So then how you chew is going to shift. And that can lead to jaw problems, TMJ problems, to like headaches, different things like that, to earaches.
Yeah.
And it can lead to other things that people don't realize. And they're just like, oh, well, it's a tooth in the back. Nobody's seeing it. I got my other teeth. I can eat. It's fine.
Yeah.
Yeah, but your body's going to compensate for that, and it's going to cause problems in other areas.
Absolutely.
So these little things lead to huge things.
But I don't even see how a person can get up in the morning and start eating a whole meal and have not brushed their teeth.
That's because that's what you and I know.
Yeah, it's no way I cannot put anything in my mouth until I brush my teeth. Period.
Right, and that's why you have beautiful teeth.
Yeah, it doesn't even taste right when you do that.
That too, yeah. It does, it dulls your taste senses and things like that. If you don't brush all that off before.
And not to mention brushing my teeth and not brushing my tongue. But I had a friend, I remember this so well. I had a friend that did that, but this was like years ago. This was like in my college days, early college days. And when we would be brushing our teeth, I would notice she would never brush her tongue. And her breath was always very offensive. Exactly. And I would be like, That's why your breath smell like that. You don't brush your tongue. No, you're not. I said, who told you that?
No, there are, because I've had patients that they're like, no, you're not supposed to. You can't use your toothbrush to brush your tongue. And I'm like, the bacteria and everything in your mouth is going everywhere.
Everywhere.
So if you use it to brush your teeth or your tongue, like yeah, you can get the fancy tongue scraper and the tongue brush and all that stuff.
But you need a brush, okay? Yeah. And not only that, when people don't brush their tongue, you can literally see it. The tongue have the strangest look to it.
Yeah, it looks kind of crazy.
Right.
And then it looks kind of crazy. And then if you're someone that's more proficient with your hygiene,
yes,
you're gonna be more sensitive to someone that's not.
I am.
So you're gonna smell. There's gonna be a scent before the person even looks at you and smiles at you.
What?
You're gonna have a scent. So that, and then of course, like if you're on a date with somebody and they're not really smiling, or there are some people that they'll just brush the front teeth because they're like, oh, that's all people see.
Yes.
They don't brush anything else. Same thing. Like the other person, there's gonna be a scent.
Yes.
There's gonna be a smell. And then if you go to kiss the person,
oh my God.
You're gonna. So the person could be absolutely amazing.
Yes.
And then you go to kiss them, and you're like, "That was the funkiest kiss I've
ever
had in my life." That alone might deter you from ever wanting to talk to that person again.
Exactly.
Because you're like, I don't know. And the thing is, if the person does have because we all, we have bacteria in our mouth, we have different genomes in our mouth, things like that. Some of them are good, some of them are bad, but it's, our mouth is the dirtiest part of our body because there's a lot that goes in and out of it.
Yes.
But we have enzymes that clean things. But if you aren't very good with your hygiene and you develop a gum disease called periodontitis, it is something that spreads. So if you're dating someone and, let's say you're like, oh, I'm so enamored with him or her, and I'm going to let this whole hygiene thing pass, or he's learning or whatever.
Yeah.
And you're kissing this person, you're enjoying and kissing this person over a period of time, they're spreading that type of bacteria into your mouth.
Wow.
And then that bacteria can start to grow in your mouth. But because you have better hygiene, it's less chance that it's going to take root as badly as that person. Yeah. But they will spread it to you.
But here's the thing. First of all, when it comes to hygiene, me as well as my kids, okay, they know we don't play that, okay? Right. Hygiene is number one in my household, okay?
It's
period.
Important.
All right?
Yeah.
Super important, okay? Because one thing that will flip me out is somebody in my face and your breath smells like garbage. Yeah. Okay, that's a problem for me because
you're going to be distracted just thinking about their breath. You're not even listening to what they're saying.
Yeah, but the look on my face is going to tell everything because one thing about bad breath, that is super, super offensive, number one, all right? And I look at it like this. I don't care what nobody say. You know when your breath is stank, okay, or not smelling the best, all right? You could taste, you could taste it, right? Yes. You could be like, okay, let me get a mint because my breath don't seem a little first. Let me wash, But when I see people are okay with bad breath,
what else are they okay with?
Exactly. And then you look at it like your hygiene is not on point because anybody, when your breath is stinks. So it's like, why are you in people's face with bad breath?
Right. And then, it's something that, of course, I'm not saying to judge people, but it just posed that question. Like, what else, are they not that efficient with?
Exactly.
What does their home look like? What is their...
Everything.
Because that's the bare minimum for them to take care of themselves. So if they're not going to do the bare minimum to take care of themselves, how are they going to take care of anything else in their life?
Absolutely.
So these little things...
tells everything.
Tells a lot about a person.
And that's what people don't be understanding. Like when you carry yourself in a certain way or you present yourself in a certain way, it tells everything about you. You're literally telling everybody who you are and what you stand for. Yeah. It's just what it is. You understand?
Yeah, and some mouthwash and some cologne isn't going to cover it.
At all, okay?
Yeah.
Sometimes you really do have to go to the dentist because in my mind, if your breath is smelling like that means the teeth is rotten. Something's going on.
Can be, yeah.
All right, so let me ask you, what are some low-cost at-home tips for keeping your smile looking great between dental visits?
There's so many.
Yeah, many.
Just like we were discussing the basic hygiene
Yeah.
of brushing at least twice a day, before thing in the morning, last thing at night, brushing your tongue, flossing every day, because where the contact point where our teeth meet, the toothbrush doesn't get in there. The only thing that cleans that contact is really the floss. So
Yeah.
if you don't, you're more prone to cavities. So those are really big. Using a water pick is always very good. But one thing I've noticed that's very inexpensive, and I've been recommending it to a lot of patients, is coconut oil. And it's, it's something very inexpensive. It's all natural. I was first recommending it to a lot of older patients on a bunch of different medications for dry mouth.
Okay.
But it also works really well at whitening your teeth.
Oh.
And it works really well with the different enzymes in your mouth to give you a really nice scent.
Yes.
Of course, you have to do the bare minimum brushing, but
Yeah,
but it works really well to give you like a really nice, just overall scent, long term wise. Because most people, like, if after a while you haven't eaten, you start to have a scent in your mouth.
Yeah, absolutely.
The coconut oil helps with that.
Oh, wow.
So like using 1 tablespoon of coconut oil like once a day, if you can swish it around for at least 5 minutes. If you can get up to 10 minutes, great. Just the regular coconut oil you buy in the jar in the cooking oil section of the grocery store, the hard one. It works really well in whitening your teeth, as far as like making really healthy gums, like so your gum, like if your gums tend to be more sensitive or bleed, things like that.
Yeah.
If you suffer from dry mouth, it helps with a lot of things. So that's something that's very, very good.
That's interesting. Wow, like that. Okay. So let's talk about breath, which we did a little bit. But what causes chronic bad breath, and how can someone fix it, especially before a date? Like, what causes a person's breath to just be
There's so
foul?
many different things.
Yeah.
So one, it could be a digestive issue.
Yeah.
Like either maybe you're hungry, you haven't eaten, or maybe you ate something that your body doesn't agree with.
Yeah.
So it could be digestive, coming from down there. It could be that simply. It could be what you actually ate. There's like residue in your mouth, or it could be that you do have some sort of infection, like whether it's like a decaying tooth,
Yeah.
or some beginning signs of periodontitis and like your gums, like a gum disease. It could be any one of those things. So like before a date, like of course the main thing, the bare minimum is just do the basic hygiene, and that helps loads. So just the basic brushing, flossing. Afterwards, if you want to use a mouthwash, as long as it's not alcohol based, because like the Listerine with the alcohol, that we love that burning sensation, it tends to dry out your mouth a bit. And when you have a dry mouth, it tends to lead to more cavities, and it can actually lead to worse breath. So, so just like the basic hygiene. And then before you go, before you meet the person, I usually recommend, I know a lot of people say chewing gum's not great, but I usually recommend chew a piece of sugar-free gum before, because for one, it does help with your breath, and it also gets the saliva moving around your mouth to get the enzymes moving around your mouth to basically balance the pH in your mouth, and that helps balance your breath.
Yeah.
Yeah.
I like that. Okay. Yeah. All right. I like that. A lot.
It's an easy fix.
Yes, very easy. Okay. So how often should someone actually see a dentist, and what should they be asking during their visits? Like, how often should someone, like for example, I go see my dentist every 6 months, and that's for my tooth cleaning and things like that.
Right.
So what would you recommend as far as?
So at the bare minimum 6 months.
Yeah.
Like usually most people need to go probably every 4 months, but unfortunately it's usually based on what your insurance will pay.
Yeah, yeah.
So if you have like just like normal like gingivitis, which is just that's not like a gum disease. It's just like you have slight inflammation with the gums. Basically you have a healthy dentition. Then I would say every 6 months. If you have a little bit more going on than gingivitis, like every 3 to 4 months. So definitely a couple times a year. You should be going to the dentist.
Yeah.
And when you go, like especially if you're going every 4 months, usually you're doing like perio maintenance because you're doing deep scaling or like deeper cleanings. So at least one of those visits, a dentist should come and check you to make sure everything is okay. Check your x-rays. Like they should do x-rays like at least once a year, because that's the only way we can see if there's cavities in between the teeth, things like that. And same thing, like if you're going every 6 months, at least once a year, like the dentist should,
that's what they do.
Should come in and check, and there should be x-rays taken.
Yep.
Yeah, and that's pretty much it. Like they should be able to see what's going on, but of course, if you notice any, because you know yourself better than anybody.
Yes.
So if you notice anything that's slightly different, no matter how small, bring it up and ask the hygienist or ask the dentist.
Absolutely. Like that. Okay. If someone wants to level up their smile in 30 days or less, What's your expert advice?
If they want to do what?
Level up their
Level up their
smile,
smile
in 30 days or less.
or less. What should they do?
Yeah. What are
Okay.
some good ideas?
So, so for one, if you want to do a more holistic route, is the coconut oil pulling. But like I think we were discussing it earlier, like
Yeah.
you could do something like bleaching. If you tend to have more stained teeth, things like that, and just having like whiter teeth that usually boost someone's confidence and things like that. That would be a big thing. Anything else would probably, require some sort of like dental help from like a dentist or things like that. But probably like bleaching,
Yeah.
whether it's like natural or using like a dental bleach would be
Yeah.
the best thing.
And I don't think it's that difficult. I just think that with the proper maintaining your, making sure you brush twice a day, flossing, just the little.
The thing is like, because once you do like just the bare minimum, like the bones bare minimum, and you're
Yes.
consistent with it, like that alone, there's really not much else you're really gonna have to do.
No.
Like your smile is pretty much gonna be on
It's
point,
on
like
point.
all the time.
Yes.
So you really don't have to do anything.
Yeah.
But if you want to just zhuzh it up a little bit, you could do a
Yeah.
little bleaching.
Absolutely.
But just doing the bare minimum consistently,
it's going to
you're
make
good.
a difference. Absolutely. And it doesn't
and,
even.
and like now there's so many things, like they even have like some patients that want to do bleaching but they don't really need to bleach that much. I'm like, why are you going to waste the money on?
Right.
So I'm like, there's so many whitening toothpastes. Even Sensodyne has a whitening toothpaste
Yeah.
that works on like different molecular structure of your teeth.
Yes.
And most of those whitening toothpastes, they do work well.
Really good.
Aside if your teeth are like really 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 dark.
Yeah.
But maybe they just need to be brightened up a shade or two.
Yeah.
Most of those whitening toothpaste, within 2 to 4 weeks, you will see like at least a 2-shade difference.
The difference.
So that's something that can work really well.
Yeah.
And that's very inexpensive.
Inexpensive, right? You could just go purchase that over the counter. How does oral health connect to overall health, and how might that impact someone's love life or self-esteem?
Well, the thing is almost any ailment that the human body can have will first show signs in the mouth. Because the mouth, it's a moist environment because of our saliva. Just like, if you go see an ENT, ear, nose, and throat doctor, another place where they see signs first are like, anywhere where there's mucus or it's moist.
Yes.
So like the nose, like in the nose membranes, lacrimal glands, things like that. I'm sorry, ask the question again.
Okay.
I got
Okay, no
distracted.
problem. How does oral health connect to overall health, and how might that impact someone's love life or self-esteem?
Okay. So their oral health, so basically, so the first signs of almost anything that you can have, like you will notice in the mouth. But aside from just like bad breath, things like that,
Yes.
There could be like if your oral health isn't the best, or especially if you're getting periodontitis, like which is a gum disease, it can basically affect many different things, because since our whole body's connected, our blood flow, everything is connected, everything flows around. Like maybe you're very lethargic, maybe you're having trouble sleeping, maybe you're getting foggy headaches, and you might think, oh, it's my hormones, oh, I'm perimenopausal, oh, my testosterone's low. No, maybe it's because you have periodontitis. You know what I mean?
Yeah.
And that can be affecting how you show up in your relationship. So it's like basic things like that, because the whole body's connected.
Yeah, I remember interacting with this young lady, and I'm just curious to know, what is this called? She was speaking to me just like you and I talking, but her gums were so inflamed and they were bleeding.
Oh,
Yeah, and I'm just trying, and I'm looking at her like, what?
Like, what?
Because I've never seen that. And I'm like, why is her? And I had to ask her. I said, what is going on with your gums like that? She said, I can't remember what she said, but my point is, she was very insecure about it. That's
Of
number one. And I could,
course.
trust me, I could see exactly this.
Yeah.
That was
Why
like
that be
literally
insecure?
disgusting. Okay. I mean, like really, it was really bad that I
Yeah.
was like, listen, I'm going to give you my dentist information.
Maybe she had like ANUG or something, like a necrotizing disorder, or
Yeah, because I was just curious to know what causes that. Like people gums to just be inflamed and bleeding, on it. Is that lack of dental care, or is that something that she needed to have surgery for? Because my thing is, it was really bad. So it's
Right.
like, I'm wondering, are you getting are you visiting a dentist?
A lot of different things can be a lack of dental care.
Yeah.
But also it can be systemic from other things. Like maybe it's like showing an underlying health problem. Maybe she has like pemphigus vulgaris or something, like an autoimmune condition.
Okay.
Or maybe it could be because of medication she's taking.
Yeah.
It can be because of like a contraindication with the difference of medication that she's taking. Like even a lot of pregnant women, like usually I've seen it's usually a lot of women, like after like their second baby, they'll get like really bad gingivitis where their gums get very swollen and can bleed like that.
Okay.
So that, that's just something going on with their hormonal level of their body because they're pregnant.
Yeah.
So it can be different things, but if you see something like that, you should definitely get it checked out because it's usually going to mean that there's something more severe going on.
Absolutely.
It's not just a hygiene issue.
Yeah.
There's something health related that's going on that's not working right in your body.
Yeah, and the way that looked, it was bigger than, to me, dental. Because
so that was a big warning sign that her body was trying to show her something's wrong.
Yeah.
You need to go get it checked out.
Absolutely. Okay.
And of course, if you have anything like that, then you're going to be insecure.
Yeah, very insecure. Because even when I remember me, giving her my dentist information, you could just see she was like, it was like, I'm like, girl, you better take this information and go see what's going on because something is going on. But you could just see like the, something. I don't know.
Because I've actually had a lot of patients like that where it's like they'll come in and they haven't been to the dentist in I don't know how many years. Actually, just yesterday, this lady, she hadn't been to the dentist in like 12 years.
What?
And she was like very embarrassed and she's like, don't judge me. I was like, listen, honey, this is a no judgment zone.
Right.
I was like, whatever you got going on, I'm guaranteed I've seen worse.
Right.
And she was like really insecure being seen by me, like scared that I was going to judge her or whatever.
Yeah.
So a lot of times like people, there's something going on, whether it's like in their mouth or health wise, and they're embarrassed, so that makes them not even want to go get it checked out because they're embarrassed about it.
Because they're embarrassed, right.
But that's when you need to go get it checked out.
Exactly.
So that's when you, especially if you're very sensitive, interview who you're seeing. If the dentist you're seeing seems judgmental, you don't feel comfortable, go see somebody else.
Right.
You don't have to see that person.
Absolutely.
Make sure you see somebody that you're comfortable with, that's going to be understanding, that can help you.
Yeah.
But don't use that as a deterrent. But it happens a lot. And I've noticed it happens a lot of all ages.
Yeah.
I've seen patients from like in their 20s and 30s, even older patients that are like in their 70s and 80s that just got to a point where they were just so embarrassed that they didn't want to show up. They didn't want to come, but they had to because they started to have real pain.
Yeah.
So then they come in.
And that pain.
And and then when the pain kicks in, they're like, okay. So then, you got to do some emergency thing to get them out of pain. And then, and then that's when I have to establish a rapport with them so that they come back so we can get everything back on board.
Back on point,
Yeah. And I have seen I have seen some patients where it's like, they've made like a complete 180. Like when I first saw them come in and I saw them for the emergency, and usually it involves an extraction. It's pretty messy. Just kind of like developing a rapport with them. They feel comfortable and they come back.
Yep.
And they end up like, going through their whole treatment plan, and then I'm able to follow up with their hygiene and things like that. And long story real quick, I had this one patient, he's so cute, an older gentleman. I think he's probably in his early mid 60s. And when he first came in, he was in a lot of pain. He hadn't been taking care of himself for a long time. I didn't pry as to why, but he did have some hardships and things going on.
Okay.
So he just let everything go.
Yeah.
He hadn't even brushed in like years. He really let everything go.
Wow.
So he finally came in because he was in a lot of pain. And we did that, and he was very quiet, very shy, and then what we had to do was going to take a few visits. So during that time, started to develop a rapport with him, and each time he came, I didn't lecture him, but I would just make suggestions on like how he should go about his hygiene. And I started to notice like a change. Like every time he'd come, like okay, like all right. I'm like, oh wow.
You'll see the improvement.
I'm like, everything's all nice and clean.
Yeah.
Today. He brushed everything. Then I noticed his clothes were all nice and clean.
Yeah.
And his clothes smelled nice and washed. And I noticed his hair was all nice and clean.
Wow.
And it was like a whole transformation. And
but it's a possibility he was doing it for you. But go ahead.
I don't think so. And probably by like 6 months.
Right.
Like the last visit when we were pretty much done with everything, then he just had to come for his checkups and hygiene. He actually would like, instead of like looking down, he would look you in the eye.
Wow.
And he was still quiet, but he would talk to you and make eye contact. What needed to be said, and it was really amazing to see like a whole transformation. So I've seen that too.
Awesome. That's amazing. Well, the whole thing when it comes to this dental thing, the first and foremost, The main thing that everyone needs to know, just do the bare minimum, which means brush twice a day, floss, make sure you clean your tongue. Let's start there.
Just
Okay.
start doing that.
Yeah.
Start doing that. That is, if you're not doing it yet, do that. It will completely transform your life. If you're doing that, continue.
Yeah.
And then everything else is just,
Yeah.
a bonus.
Maintaining. Like I say,
Yeah.
if you see something weird on your teeth, hey, I need to go to the dentist.
Exactly. And the thing is, there's never any stupid questions. It's better if you see something like really small, it's better to go get it checked out. And it turns out that it's nothing versus you wait till it becomes something really big and then it's a whole problem. And it's going to be a lot more expensive too.
Whole issue.
So if you see something little and don't be embarrassed. That's why we're here. That's why you have dentists. That's why you have doctors. You go, you ask a question.
Right.
And that's it.
And you establish a relationship with your doctor, your dental care, whoever it may be. Just establish those relationships because trust me, they're not judging you.
Exactly.
That's why you all are there to help.
Exactly.
Yeah.
And just like that lady that you were saying, with the bleeding and things like that, that most likely could have been more of a health issue.
Yeah.
So that's something that she does need to get checked out.
Yeah.
So, and then if you're shy about it, it can lead to other things. And, just like anything, if you're not comfortable, most importantly, if you're not comfortable with who you're seeing, then find somebody that you are comfortable seeing.
Absolutely.
That's the most important thing.
Absolutely. Dr. Monique, this has been absolutely amazing. I'm sure you have educated so many people today. I'm sure they are going to really take some good information, good advice from you and apply it.
Thank you. I hope so.
I thank you so much for being here. You have been absolutely wonderful.
Thank you very much for having me.
Thank you, Dr. Monique. Yay!